guys, it's me, Dr. Samina Rahman, Gyno Girl. I'm excited to talk to you a little bit about menopause and what's happening out in the menopause world when it comes to celebrities, Generation X, supplements, and research. So next month, which is October, is Menopause Awareness Month, and I am attending a menopause conference, the Menopause Society's conference in Philadelphia at the end of September. So I will be bringing you new data and the latest. But, I think that last year sometime, New York Times had put an article out called the Menopause Gold Rush. And this is interesting because I've talked about this in other videos about what's happening in the menopause circles and how apps are popping up, how supplements are popping up, how everyone wants a piece of the menopause pie. But there are reasons for it. There are reasons. If there's number one, we're going to talk about Generation X and the people that are taking back their quality of life. We're going to talk about the research that I presented on this Instagram video about menopause and the lack of training that is gotten in OBGYN residencies, and I'm sure across the board in internal medicine, family practice, and other areas where women are seen, urology. We're also going to talk about why we're in this situation, the sandwich generation, and all that good stuff. So please like and subscribe to my channel, and let's go. Let's talk about menopause. Okay, so today, because next October is Menopause Awareness Month, and I'm going to the Menopause conference at the end of September, so you guys will see that on my Instagram. I want to talk a little bit about this menopause gold rush, what's happening with Gen X, and the article that I discussed in my Instagram around menopause training for OBGYNs. So number one, I'm Dr. Samina Rahman. I'm a gynecologist, board certified. I have been in private practice in downtown Chicago since 2014 and have been singing and praising about menopause since then. But basically I have a private practice and I am specialty trained in sexual dysfunction. So I'm a fellow for the International Society for the Study of Women's Sexual Health, as well as a menopause clinician for the Menopause Society, ishwish.org and menopause.org. What I want to discuss was this article from the Menopause Journal last month, and it showed that there was a research study done on what kind of training do OBGYNs get for menopause. So think about this, a midlife woman may or may not see their OBGYN anymore, right? They may be seeing an internist or cardiologist, endocrinologist, family practice, whatever the case may be. And maybe in your 40s, when you did go in for your annual PAP with your gynecologist that delivered all your babies, maybe they didn't do the peri talk with you. I always like to try to do a peri talk with my patients. You get a puberty talk, you should get a peri talk, which is like what's to come when your hormones cease. And so if you didn't get that and you're starting to get other medical conditions, maybe you're seeing your internist. So we don't even know. We know that most people expect OBGYNs to talk to their patients about perimenopause and menopause. This study showed that of the 90-something residency program directors that were interviewed, basically the statistics were this. The large majority, over 97%, thought that we need to do more for menopause training. 2/3 of residents graduating had no menopause training. Of the ones that did have menopause training, the large majority had only 1 or 2 lectures. Even though 75% of the residencies may have had some menopause clinics, only 1/3 mandated that their residents actually see a midlife patient. So this is alarming, right? This is supposed to be, we're supposed to be the experts in women's health. And so when this is showing us that our training is lacking, and we know that, right? And how do we know that? We know that because the women experiencing perimenopause and menopause are more or less in Generation X, right? Generation X is from 1965 to 1980. And so, these women are experiencing these symptoms now. Generation X is a little unique. I like this Instagram influencer, Kelly Mano. She talks about Generation X. She's very funny. And she's kind of like, we're the don't F with us generation, because we were around before Google. We were latchkey kids. We know how to use the internet. We know how to use maps. We know how to talk to people. We know how to text. A lot of this is not happening with our future generations. And so in some ways, we were the generation that, was raised with fear mongering that we're going to get kidnapped at any corner, but yet we were out till, 8 p.m., 10 p.m. every night, playing with our friends at our neighbors or on our bikes. And actually, this was funny because there used to be a TV announcement at 10 p.m. Do you know where your kids are? This is a true story. So, this is obviously not how we are raising our children. We're more like helicopter parents now as a result of that. But I think it's interesting because in Generation X, we're also the sandwich generation, right? So we're dealing with raising our children, and we're dealing with aging parents, or maybe a lot of parents have, passed away, unfortunately. And so when you're dealing with aging parents, if you're dealing with an aging mother from that generation, that's the generation that didn't get their hormones, right? Because that was 2002 is when the Women's Health Initiative came out. And so they got all their hormones taken away from them because of a lot of misinformation, and the FDA and the media really did a disservice for women at that time without doing the appropriate follow-up about what was really happening with the hormones and what the real data is, which I can do a separate video about. So here we are dealing with Generation X, now dealing with these symptoms, who when you ask your mom about it, you just, oh, suck it up, buttercup. There's nothing to do about this natural aging process that we have. It's just natural. You just have to deal with it. And most women right now are like, hell no, that's not what's happening. And so what happened is, you had an opening for women to seek help, right? That's how these compounding pharmacies evolved, because women weren't getting the care they needed from their clinicians. And that's unfortunate. We know implicit bias exists. We know that, women of color experience it more than white women, but it's across the board. And so you're not getting your hormones, you're not getting any guidance, you're just being told it's in your head. And what happens? Celebrities who are experiencing it and got the runaround from their clinicians are now speaking up against the medical community in some ways, but also promoting, whatever supplements they're doing. Like we have Naomi Watts, we have Gwyneth Paltrow, we have Drew Barrymore. Obviously, Oprah did an amazing menopause discussion with some of my friends and colleagues. And so we have all this awareness that we're building, right, at the same time, which is amazing. So thank you to all the popular celebrities out there doing the work that unfortunately a lot of clinicians are not doing. But they're also getting listened to more by women because, these are people that have been in the spotlight. And for one reason or another, if you see a celebrity, like when Kim Kardashian says something or, promotes something, it gets sold out, this kind of thing. And so the same thing happens, but this is also an opportunity to prey on women, right? Everyone speaks out against big pharma all the time, right? Big pharma, multi-billion-dollar industry, big pharma. But no one ever says how the natural supplement industry is the same, but it's super unregulated. And anything can go through pretty much without, a discussion or research. Whereas in big pharma, at least, we have a lot of research before anything gets FDA approved. And so we have this scenario where we have all the supplements and natural products, and influencers are rising to tell women what to do with themselves, and clinicians are starting to do better. But, this is what's happening in the menopause world right now. And I think that I totally understand why women have turned to celebrities or have turned to alternative ways of treating themselves, because their whole life they've been told that this is in their head or whatever the case may be. So this is not okay. And I want to tell my patients or women listening that I understand why this is happening, and I understand why you've had to turn to the places that you've turned to. But I'm hoping that now, with the menopause organization being more prominent and more awareness is being built about menopause, about hormone therapy and the safety and the efficacy of hormone therapy, as well as vaginal estrogen use for sexual functioning, testosterone use for HSDD, some of the things I've discussed in the past. So I'm hoping that now, with the rise of a lot more menopause trained clinicians, even though it's not where it should be, with more social media, which is plus or minus, but I think that there is some benefit to speaking to patients and educating them through this platform, that maybe we'll get better service for our women, our Gen X women going through this right now. Also, there's a lot of menopause apps popping up. There's Alloy, there's MIDI, there's look at all this list right here. And so, there's a lot of menopause apps for patients that cannot access a clinician. You can go to www.menopause.org and you can put in your zip code and you can find a menopause certified doctor or nurse practitioner, mid-level provider that had to pass a test, had to keep up with their CMEs, goes to potentially a lot of the conferences that I go to, and they're up to date on the data. They're up to date, hopefully, all these clinicians are. And so you can go to that, and if there's a menopause doctor in your area that can help you navigate through these hard times, then that's one thing. But I understand why the menopause gold rush has happened. I understand why all these apps are out there. I understand why the celebrities are speaking about their journeys and about how they did not get the help they needed, and now they're utilizing supplements or investing in companies to get a platform for patients out there. And so if you can't get to a menopause doctor in person, because obviously exams are helpful, obviously seeing someone face to face is different than on a televisit. But I do, or even just electronically, where you're talking to someone through some form of electronic method. And so I see the benefit of that for so many women who are going through this. And so if you're not able to access a certified menopause clinician, or maybe unlike I do take insurance, unlike a lot of my colleagues that do not, because insurance does not reimburse you what you feel like you deserve for the amount of time that you speak to patients on menopause and sexual health. So if you can't afford that, or you can't find a clinician that takes insurance, but you find this virtual platform out there, then by all means, utilize it. Hopefully it's one that is using FDA approved products. But you should know that there are clinicians out there that we are trying to change the narrative for women. And I'm proud of Generation X for trying to get our control over our health again. So I just wanted to kind of talk about the research and how there's not been a great training for patients or for clinicians in menopause, but there's starting to be more awareness about it. And so hopefully the narrative is changing now that the menopause gold rush is on and people are trying to monetize everything they can with menopause. So whether or not it's an app, whether or not it's a supplement, whether or not it's books, whatever the case may be. But I think a lot of it is amazing. I think that getting the education out there is amazing too. So please, just know your source, know who you're dealing with, know if there's evidence behind it. I mean, I've definitely seen patients who are on compounded regimens who come to me and they have endometrial cancer because they were using the wrong type of progesterone, or they have other side effects from unregulated supplements or compounded agents. So please be buyer beware, but also I get it. I understand why this has happened. Hopefully we can do better for our patients in general, but our female patients and our women of color also. So that's my little spiel for the day. I hope you guys are well, and more to come. Please let me know if there's any other talks that you want to have, and I'm working on more content as we speak. All right, so talk to you later. Bye.